the Dapsone therapy. In baseline investigations, we have to take the complete history, we have to do the physical examination, then we have to do complete blood count, liver function test, renal function tests, G6PD levels, and urinalysis. While doing the follow-ups, we have to do complete blood count with differentials every week for 4 weeks, that is for first month, then every 2 weeks until week 12, that is for 3 months, and then every 3 to 4 months. Then we have to do reticulocyte count, liver function tests, renal function tests every 3 to 4 months, and then methemoglobin level if there are signs and symptoms. Okay, G6PD deficiency is the most common disease producing deficiency worldwide. It's an X-linked inherited disorder, and some people with G6PD deficiency are completely asymptomatic, but some shows symptoms in whom there is severe deficiency. G6PD basically catalyzes the reduction of the NADP to NADPH as shown in this picture. So we can consider G6PD as father and NADPH as son. This reduction of NADP to NADPH is via pentose phosphate pathway, and which it is the only method of NADPH generation in erythrocytes, that is SMUF, home, or mushroom. They are therefore more susceptible to oxidative stress via drugs, for example dapsone, infections, or dietary triggers, for example fava beans. So this deficiency of G6PD greatly increases this load and can lead to hemolysis. NADPH is also required to convert methemoglobin, that is ferric form, to ferrous form to hemoglobin. But when it is deficient, because of the deficiency of G6PD, then there is increased ferric form and methemoglobin. So this form of the iron strongly binds to oxygen, and when it is required to release oxygen to the tissue, it does not do that because of the strong affinity of the ferric, and there is tissue hypoxia, which is leading to cyanosis that confers blue colored skin, that is showing blue smurf. So this can be treated with methylene blue as it is shown in the picture. Methemoglobin ferric form or blue smurf has been turned to pink by the use of the methylene blue. So it is the treatment of the methemoglobinemia as well. These are the G6PD levels. You can see later on. I'll share the presentation. Dapsone contraindications are dapsone hypersensitivity, acute porphyria, severe ischemic heart disease, pulmonary disease, severe anemia, and severe G6PD deficiency. In pregnancy, the dapsone is safe in pregnancy but can cause hemolysis and methemoglobinemia when used in third trimester. So we have to give folic acid 5 mg daily with dapsone to avoid hemolysis. This dapsone is present in breast milk as well, but the risk of hemolysis is small until the infant is G6PD deficient. Talking about the adverse effect, it is hemolysis, methemoglobinemia, agranulocytosis, dapsone hypersensitivity syndrome, severe cutaneous reactions, gastrointestinal effects, peripheral motor and sensory neuropathy, and renal adverse effects. Alarming signs. While on the dapsone therapy, we have to look for sore throat, mouth ulcers, purpura, and bleeding, which indicate agranulocytosis. If there is shortness of breath, chest pain, blue skin, yellow sclera, which indicates hemolysis and methemoglobinemia, and if there is rash, pruritus, fever, lymphadenopathy, this indicates dapsone hypersensitivity syndrome. So we have to keep in mind these signs and symptoms while the patient is on dapsone therapy. Thank you so much. I have tried to cover all about dapsone. If something is missing, sorry for that. I hope this presentation will be helpful while revising dapsone.